The Her Majesty's Inspectorate, who are responsible for inspecting police forces across the country, have been commissioned by the Home Secretary to do a report on crime recording. We were the first, we were the first force to be inspected, and so far they've done 13 forces out of the 43 across the country, but they've done including the Met and GMP, so some of the bigger forces as well. They've identified some issues in there, and the headline figure from the Home Secretary today is up to 1 in 5 crimes might be underreported. We don't think that relates, that we don't recognise that figure in North Yorkshire, or we do, but we do recognise, according to some of the new definitions of crime recording, that we may be under-recording. They stress that there is no manipulation of data. We're not trying to under-record data. It's how people are interpreting the rules. So be very clear. When they talk nationally about rapes not being reported, I spoke to the HMIC in London on Monday night, and none of those relate to North Yorkshire Police. So when they talk about 13 rapes not being reported, that doesn't relate to a rape in North Yorkshire or a number of rapes in North Yorkshire. And in areas like robbery, they say we have 100% compliance. There are other complications in terms of crime recording that we need to address. The rule book governing crime recording is over 450 pages. So when someone says it's a simple process, it's not. Our focus is on the victims of crime. So we don't expect the victims of crime to understand nor should they, the issues about crime recording. It's about saying, we want to listen to you, we want to understand why you're a victim, what you're telling us, your levels of vulnerability. We've done additional training in the force control, and the staff in there have really been, they were recognised by the HMIC as being very caring and understanding. But also we're working with people, sometimes with complex needs, sometimes with vulnerabilities, sometimes where they cannot remember what's happened to them at all. And we need to be listening intently, working with them. And today actually has seen the annual report, the first annual report for the SARC, the Sexual Offences Reporting Centre. And there's an area where we're really trying to encourage people, members of the public who've been victims, to come forward. Sometimes it's not easy, sometimes they don't want to engage in the criminal justice process because they're worried about going through to court. We're saying, it doesn't matter if you don't want to go to court. We want to understand if you're a victim in the first place. And then we try to create the right pathways for care. So if your interest is not, you've been a victim, but you don't really want to go through a Crown Court process, we've got an excellent team led by Sarah Murphy in the SARC who are saying, right, our interest is trying to provide you with the right medical support and mental health support to get you through this. For others, of course, they want to go through the court process. So it's about a mixture of things in there, but our drive will be to focus on the victims, focus on people who need our help. There's a degree of misunderstanding about crime, as I say, crime recording processes. We need to do some more some more training at the front line. There's very easy and standard processes for reporting which are straightforward. So you can report being assaulted on the street and the officer or the force control will get that right every time. I've got examples, for example, on the East Coast last year where we convicted a beautician of a series of assaults. The assault was because she wasn't trained in any shape or form to give Botox injections. So between ourselves and Humberside, we had countless crimes recorded for assault. Because that's not an obvious crime recording process. Someone hitting someone in the street is clearly a Section 47 assault. That was dealt with, and she appeared at Hull from memory, and we had at least 20 crimes recorded because she'd injected 20 separate females with Botox. So that's just one example of the complexity. Others are when victims simply cannot remember what's happened to them. So they'll present to an officer and they'll have an injury, but they can't remember if they've fallen over, if they've been assaulted. So these are, and then you go back and check things like CCTV, and you find out the person's you can see them falling over. Now, on the other hand, we shouldn't jump to a conclusion. In the past, we may have jumped to the conclusion if they can't remember, they must have fallen over. If they really can't remember, it's possible they could have been assaulted, and if they come and say they've been assaulted, we should accept that at face value in the first instance. And it's those sort of instances, because this morning there'll be a series of phone calls into our force control room, and the callers will pick up the crime, and if they said, my car's been broken into overnight, They are very standard processes to go through. So we need to work on the understanding of staff. The force control room have already been recognised as good, but they're working on getting better. Our force registrar was recognised by the inspectorate as being a really strong and good advocate for independent governance in relation to that. But yes, of course, we're not completely ignoring the fact that there are recommendations in there that were made about us that we need to pick up on. So we'll look at those. Difficulty with today is we've got a generic report covering 13 forces. We haven't got our own individual report yet. All we've had is the initial feedback from the HMIC, which is very different from seeing the printed detail. But when I got the hot debrief from the inspection, there were some actions there that we immediately put in place. There were issues about how we picked up first comments from the public. So we addressed those. We addressed those through our Protecting Vulnerable Peoples unit. So we've already done some things in relation to it. We didn't wait. And indeed, before we even had the inspector here, we'd done an audit in relation to antisocial behaviour, and where sometimes that the line between that and crime is quite fine at times. So we've done all that.
So what can the public see as the next steps and the outcome? Because there's obviously a concern being lodged by the forces inspector.
Yeah.
What will be the next
Well,
step?
the next steps are, certainly the Police and Crime Commissioner will hold the Chief Constable account, which is what the right process is. We've reported initially to the Joint Independent Audit Committee, which is, so we will continue to do that. And we will have a notice, which was like an area actions notice from the inspection. We've done most of those already, but we'll pick up on those. I would reiterate that North Yorkshire fundamentally is still a safe county. This isn't going to change that. We only last week nationally had data released from hospitals in terms of accident and emergency units, which was saying levels of people presenting with injuries due to violence had fallen to an all-time low over the last 10 years. So that's not our data, that's health data. The British Crime Survey isn't our data, it's something that comes from another source. What I would say is that for victims of crime, yes, we're always striving to improve our service. And actually, the British Crime Survey says that victims already have one of the highest levels of satisfaction with the treatment they get from North Yorkshire Police compared to other forces. That in no way means we're complacent, because we recognise every time we fail a victim, that is a failure for that individual, and they go away with a very negative perception of North Yorkshire Police. We need to make sure every victim gets a good quality service.